Yeah, so this patient developed a DVT and I believe also a pulmonary embolism, yes, and she died shortly after admission. What is the most likely etiology in this patient? Okay, now this patient has a very strong family history of a pulmonary embolism. Okay, so as I said, whenever there is a family history or a past history of recurrent embolisms or thrombus formations, it can be a genetic condition. And this patient herself developed a pulmonary embolism after developing DVT, and despite anticoagulation, she did not survive. Okay, so it is a genetic condition, it is protein S deficiency. Distal peripheral microembolism. Microembolism cannot cause a severe pulmonary embolism. It is not DVT that is being talked about here. Your heparin-induced thrombocytopenia is not possible because she was given a vitamin K inhibitor, which is your warfarin. She was not given heparin in the first place. Then comes our necrotizing fasciitis. It does not present with any kind of thrombus formation. It is your subcutaneous and your facial layer infection. So there is a lot of necrosis and damage to your skin, subcutaneous tissue, and facial planes. There is nothing to do with your deep veins here. And your Waldenstone macroglobulinemia will detect more will have a thrombotic feature, but it will also give another feature. It will give bone marrow features or features similar to your multiple myeloma of sorts. Okay. In this case, it is a pure thrombotic genetic disorder, which is a protein S deficiency. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.